Assalamualaikum. My name is Dr. Azka Bilal. I am a child psychiatrist. I work at Austin State Hospital. So I mostly work with patients who are admitted to the hospital, but I am aware of the challenges that people face in the community. And the topic that I'd like to address today is aggression in children. We know that it is a major public health concern. It's one of the most common reasons for referral to child psychiatry. And I would like to talk about what aggression in children actually means, how it presents, and what are the factors that contribute to it, and how we can treat our kids that may be displaying these symptoms. So what I will do is I'm going to share my slides, and what I would recommend is if you have a question, you can either put it in chat, or you can, or at the end of the session, I will hear your questions, so you can say them out, or you can type them in chat, and then I can answer them for you. Okay, so I hope you're able to see my screen. I did not hear otherwise, so I'm going to assume you are. Okay, perfect. So what is aggression? Aggression is an action or threat of action that is intended to harm another person. It can be harming somebody physically or psychologically. When does this become a problem? So pathological aggression or maladaptive aggression occurs outside an expectable social context. So if there's a trigger, but it's a small trigger and you don't expect the reaction to be that big, but it is, then that means that there's something wrong. And pathological aggression occurs in the absence of antecedent social cues, or with an intensity, frequency, duration, or severity that is disproportionate to its causes. And it generally does not terminate in an appropriate time frame or in response to feedback. So it's intense, it can be more in frequency, the duration is more. So those are the signs that the aggression is a problem and that we need to do something about it. Now we know that it's common for children under the age of 5 to have temper tantrums. Most of us are familiar, most of us who have kids are familiar with the terrible 2s or the terrible 3s, where the toddlers, they start kicking, pushing, biting, when they're not getting their way or they want something. And those kind of behaviors increase in frequency during that time, but they go away typically by the time the child is about 5 years of age. And it's usually because the brains of these kids are developing, and they start walking and they start moving around, and they want to be more independent. They want to explore the world on their own. And at this time, they start to test limits. They want to know how far they can go without getting in trouble. And then when they do not get their way, they display tantrums. Or on the other hand, if there is something that they want and they're not able to express themselves because their language is limited, then they may also display some aggressive behaviors. But, like I said, these behaviors go away most of the time by the time that the child starts kindergarten. The range of aggressive behaviors that we are able to see are physical aggression, such as poking, pinching, pushing, spitting, tripping, hitting. It can also be verbal aggression in the terms of insults and taunts, and lying, cheating, setting fires. It can also involve sexual aggression, and bullying, which we often encounter in schools, especially in middle schools and high schools. So aggression can be classified into two main types. The one that we're more familiar with is the reactive aggression. That is the one that usually occurs in response to a stimulus. So something does not go the way the child wants it. They get angry, they get hostile, and they get defensive. And, you know, they would hit something or they would hit the other kid. And it's usually impulsive, not planned. And after that trigger is gone, the child is back to normal. Proactive aggression, on the other hand, is the one that is more deliberate. It's usually planned. And it's usually with the goal of achieving something. So either it's benefiting the child who's the aggressor in some way, or it's intended to harm another person. So there's more planning involved in this situation. So when we think about what actually goes on in our brains or in the brains of kids who become aggressive, it's very complicated. So as we know, we are not familiar with all the neurotransmitter systems or the chemistry that's going on within the brain. It's pretty complex, but we do know that there is an imbalance of neurotransmitters, hormones, and the one that's most significant is serotonin. So there are low levels of serotonin have been found in individuals that display aggressive behavior. So either the serotonin is not being formed, or it's being broken down pretty fast, or it's not working the way it should be. So research has found that CSF levels of serotonin metabolites have been inversely correlated with measures of aggressive behavior in both male and female primates. On the other hand, aggression has also been linked with the stress hormone, cortisol, that usually increases when there's acute stress. So in acute stress or anxiety states that lead to aggression, there has been association that the peripheral cortisol is increased. On the other hand, those that are experiencing chronic or post-traumatic stress, we have also found that there is reduced amount of cortisol. And then most of the time we associate testosterone with male aggression, but this is more of that pro-social dominant behavior, the male dominance. It's not associated with the antisocial or the pathological aggression that we are talking about today. Aggression also has a strong genetic component. We have seen in twin studies that there's a higher concordance rates for aggression amongst monozygotic twins compared with dizygotic twins. And the heritability estimates are anywhere from 0.28 to 0.72. Now, the fact that it's such a big range probably means that environment plays a major role in whether the individual is going to display aggression. So that is actually good news, because we can alter the environment. We cannot alter genes, but we can change the environment. And there is greater susceptibility to adverse environmental factors in genetically vulnerable individuals. So those that have a high genetic susceptibility are more likely to respond to the adverse environment compared to those that do not have that genetic makeup. The prenatal environment that the mother provides for the baby is especially important in the development of the child, and has also been associated with aggression. So maternal use of alcohol, nicotine, or other drugs during pregnancy increases the risk for both ADHD as well as conduct problems, because it affects, again, those neurotransmitter systems, and may also alter gene expression. Trauma is one of the most significant factors that is associated with aggression. Studies have shown that childhood physical and emotional abuse and neglect are associated with aggression, and repeated or prolonged exposure is related to increased risk of aggression and violence. And then exposure to violence in the household also appears to be significantly associated with aggression. So what we know about trauma is that individuals that have, say, PTSD, so there's a child who may have been molested by an older cousin, experienced sexual trauma, they get reminders of the trauma that they experience, and they try to avoid those reminders. And therefore, if they're in a situation, say, for example, this child has to attend a birthday party where he or she may experience see this cousin again, or maybe another individual from the family, it may remind them of what happened before. And in order to avoid them, they may engage in aggression that may or may not be targeted towards that individual. So it's important to keep that in mind, that if a child suddenly starts displaying aggression, that is there some kind of trauma that they experienced or they witnessed in the past. So that's something that we always want to keep in the back of our mind. Then again, the parenting and the family structure is really important in the development of the child, and also has been associated with development of aggression. So authoritarian parenting, where there's more focus on obedience, discipline, and control rather than nurturing, has been an associated factor. Corporal punishment, poor supervision, large siblings where there are many siblings and parents are not able to devote enough time to each and every child as they would like to, coupled with maybe poverty and other stressful factors, can lead to aggression. Parental separation, conflict, divorce, single parent households, any history of criminality in the parents, as well as poverty, appears to be associated with aggression. Then again, peers are an important part of any child that is growing up. And if they feel that they're not accepted, or they feel they're feeling rejection, or they're experiencing bullying, those again are factors that can lead to aggression, either because in order to decrease the distress that they're experiencing, or they could be trying to defend themselves. So we also want to keep that in mind and understand what's happening in the child's life in terms of their peer interactions. Then again, media, our children nowadays, especially with, the COVID isolation, they're spending more time indoors. And when they spend time indoors, they're watching a lot of TV, playing a lot of video games. And research has found that children exposed to violent media may become more numb to violence, and they start imitating the violence, and they may show more aggressive behavior. And this is especially true for younger children who are not as mature to understand what's happening. So it's always important to keep that in mind when our children are unsupervised and are watching or playing video games. Now, if you have an aggressive child and you want to know what's going on, so the best way to deal with it is, first of all, to stay calm. You want to give the child an environment so they are able to talk about what's happening. So talk to the child and try to understand what's going on in their mind, and be non-judgmental. You want to set limits and clear expectations for behaviors. You want to let them know that the aggressive behavior is something that is not tolerated. But at the same time, you also want to understand why it is occurring. when your child is engaging in positive behaviors or is not engaging in any negative behaviors, you want to encourage them. You want to use lots of praise. You want to offer rewards to further reinforce those positive behaviors. And when they are engaging in behaviors that are not intended to be, then you want to use negative consequences, but not punishment. You always want to identify and try to eliminate triggers. You want to avoid power struggles and be more supportive and empathic, just like we talked about a little while ago. But if this is not getting you anywhere, then you do want to seek professional help. And it's always good to seek help rather than just wait for the behavior to get worse and then get it out of control. So what are the warning signs that you want to be aware of? If your child is displaying extreme irritability, their mood seems to be unstable and they're irritable most of the time, that is a clear indication that something is wrong. If they're displaying aggression more frequently, it's more in duration, it's acting in response to small things that you would not expect the child to react to, or there's a sudden change in their behavior. So that's a sign that there's something wrong and you do want to seek help. And again, if there's a risk of serious harm to others, or the child is putting themselves in danger as a result of their behavior, again, you want to seek help as soon as possible. And you can talk to your pediatrician. You can try to find a therapist who can talk to the child to figure out what's going on, or you can consult a psychiatrist. So these are all the options that you do want to avail. If there are problems in school, most often schools have school psychologists, so you may want to talk to them so they can help you and guide you in the right direction. So when a child who comes to us for the chief complaint of aggression, what we usually do is that we interview the child as much as we can. We try to get as much information from them. Sometimes they're able to share verbally, but at other times they could be guarded, especially if there's a history of trauma. But we still are able to get a lot of information from their body language, the way they're engaging in the interview. And then obviously, one of the most important things is interviewing the parents, trying to get as much information from them about the child's life history from the time that they were born to the current time, and trying to figure out what, if there are any stressors involved, if there was any change that could be contributing to the current situation. We also want to identify, again, those individual, family, or peer risk factors that we talked about. We screen for substance use. And then obviously we screen and diagnose any psychiatric disorders that may be present, whether it's depression, anxiety, or conduct disorder, or ADHD. So we always screen for that, and we have a lot of differential diagnosis because we want to keep our mind open to see what could be contributing to it. It's possible that it's not just one reason, but there's a combination of factors that led to this presentation. And sometimes you also order some kind of neuropsychological testing, maybe to test the IQ, or to test, or for specific reasons to see what other factors could be contributing. So in terms of the common psychiatric disorders that are associated with aggression, we know that attention deficit hyperactivity disorder is associated with a lot of emotional impulsivity. So these kids have difficulty regulating their emotions. They're quick to react. They have low frustration tolerance. And as a result, they can engage in aggressive behaviors. Oppositional defiant disorder. So these kids have difficulty with authority figures. So they like to control their behaviors themselves and to not like anybody telling them what they need to do. and they become defiant. And when things are not going their way, they may engage in aggression. Then we also have conduct disorder. So this is a repetitive pattern of behavior that violates the rights of others or major societal rules. So these are kids that may like to set fires or may like to show aggression towards other people without any apparent reason, or towards pets. And they may also lack the empathy or guilt that is usually associated with doing something wrong. Then there are other disorders that could also display aggression. Autism spectrum disorder, intellectual disability disorder. This could be related because to the fact that they have difficulty in communication, or they may have a lot of distress or anxiety as part of their disorder that could lead to aggressive episodes. Depression can also present with irritability. Depression does not just mean a sad mood. In fact, in kids, depression usually presents with an irritable mood. So if the kid is irritable, they can also get aggressive. Bipolar disorder, anxiety. So kids that are anxious, they're always trying to decrease their anxiety by avoiding what's making them anxious. And if they're put in anxiety-prone situations, they can become aggressive. Post-traumatic stress disorder, we just talked about trauma and how individuals that have experienced trauma try to avoid the stressors. And then they are also hypersensitive to the environment around them. And they could think of an ambiguous stimuli as being threatening to them, and they could react to them much quicker than an individual without trauma. Traumatic brain injury is also associated with mood changes and aggression. In terms of treatment, so once we have a full thorough evaluation, and the evaluation doesn't have to take place in, it does not have to be complete in the first session, but it could take a series of appointments for the clinician to fully understand what's going on, then they're able to develop a plan. And the most important treatment for aggression is the psychosocial interventions. So therapy plays a major role. And a lot of it has to do with the parent training. So behavior parent training is evidence-based, and this is basically training parents on how to have positive relationship with their child. And it attempts to break that reinforcement cycle that may be contributing to the aggression that maybe parents are not aware of. Maybe they're doing something that is actually causing the kid to be more aggressive. So it helps train the parents to improve the communication with their child and to decrease the amount of aggressive behaviors. For really young children, there's a form of therapy called parent-child management training that is often used, and that is evidence-based. And then for the older child who is able to participate in therapy and is able to talk about what's happening, CBT, cognitive behavior therapy, can help the child recognize what is happening, to understand that their behavior is related to what they're thinking and how they're interpreting what's happening in the environment. And it helps them change their perception of what the environment is showing them, and to change their behavior accordingly. If there are major problems at home, there's decreased communication amongst family members and it's impacting the child, then structured family therapy can be really helpful. And in high-risk youth that are displaying aggressive antisocial behavior, usually in communities that have a lot of these risk factors, multisystemic treatment is especially helpful. And this is very helpful for those kids that may have been involved with the law, with breaking the law. Then there are prevention programs. Schools have violence prevention programs, anti-bullying campaigns that can decrease the bullying and the peer problems in school that could contribute to aggression. And then there's also preventative parent training that can be helpful. Now, in addition to the therapy, sometimes medications can also be used as an aid to improve the behaviors. We do want to keep in mind that there's no medication that treats aggression, but medications can help other symptoms that could be associated with aggression. For example, if a child has ADHD and they're really impulsive and hyperactive, stimulants can help with those symptoms and therefore decrease aggression. Mood stabilizers can be helpful. Antipsychotics, especially risperidone and Abilify, have been used in kids to help with aggressive behaviors. If there is anxiety or depression, we can use the antidepressants in those situations. Differential diagnosis is the key. We always want to keep our mind open for different possibilities. We know each and every child is different. They may not just have anxiety, or they may not just have ADHD. They could have a combination of these things. So it's always important to identify these conditions and treat them accordingly. That can further improve the behavior. So that's it, what I wanted to talk about. And I think aggression is a major public health concern. And if we are able to identify it early and identify the risk factors, we can help treat it properly. And then in many situations, if parents are able to understand what can cause aggression, we can also prevent it from happening in the first place. So what I'll do now is I'm going to see if any of you have any questions and I can answer those. You can either say them out loud or type them. Yes, so the question is, can we know how to get the necessary therapy and how do we get referrals? So I think the first, the point of contact, if you need help for your child, is your primary care doctor or your pediatrician. So you want to talk to them about it, and they usually have a list of resources that are available in the community. If they feel that the condition is severe enough, they may also refer you to a psychiatrist, or if you choose to, you can just try to get a consultation with a psychiatrist. And it's always important to get a thorough evaluation so that the clinician can guide you as to what specific kind of therapy would be helpful in that situation. So again, a thorough evaluation is the key. And then you can get to the stage where you can find out what kind of therapy and then what referrals are available in the community. So the question is, what is the difference between a negative consequence to punishment? That's a very good question. And that's something that is difficult to understand as well. So basically, punishment is, just like if you would try to add something. So if a child is displaying a negative behavior, you would try to add something to thinking that that's going to decrease the behavior. For example, some parents may hit the child, right? So they are adding a behavior to decrease that behavior. On the other hand, a negative consequence is basically a behavior, is something that you would take away with the intention that the negative behavior is going to decrease. For example, our children are, they love to use their phones or their iPads. But if they're engaging in behaviors that is not what we want, we could say that we are going to take that away. You're not going to get your iPad because you did this, and it's going to be for this certain period of time, say 3 hours or a day. And then when you're able to display good behavior, you will get it back. So in that way, the child is able to learn that in order to gain something, they have to display the good behavior. So the frequency of the good behavior increases. And on the other hand, they know that if they're engaging in negative behaviors, that is not getting them anywhere. They're not really earning anything. And because of that consequence, they are going to not do that again, possibly. Any other question? So I'm going to read out what's typed here. I think you're still typing, so I'll just wait. Okay, it says if the kid does not like something, but you want to introduce them to a different activity, this may lead to aggression, but how can we get that? So, I mean, you know, you're going to encounter so many situations like that where we want kids to do something and they do not like it. So it's important to set limits and to let them know that this is something that you expect them to do. And it's very much possible that they are going to try to persuade you not to do what, because they do not like it. And part of it is that they're going to try to engage in aggression. So what you want to do in that situation is to, first of all, stay calm, keep your cool, and you still want to do what you have to do. It's possible that they may try to increase the aggression more and more, but eventually when they see that you're not really paying any attention to their behavior, to that negative behavior and that aggression, they will think that it's not giving them any benefit. So they will stop doing that. They will stop engaging in aggression. Obviously, this is the kind of aggression that we're talking about is not where they're actually doing something to harm another person, to stab somebody or to kill somebody. This is, you know, just like the hitting, kicking, pushing, that kind of an activity. And then you want to use the negative consequences with the hopes that their behavior is going to change. And sometimes it does take a little bit of time, but you know, we see that behaviors do change. Often parents give in too quickly, and they think that, oh, I don't want my kid crying, or I don't want them pushing and kicking. And they're like, okay, let me just give it to them, whatever they want. Say, for example, if they want their iPad, I'm just going to give it to them. But that in that situation, the kid just learns that all they have to do is to throw a tantrum and they're going to get what they want. Okay, so the next question is, how can we manage aggression due to sibling rivalry? So in that, I mean, sibling rivalry is pretty normal. You know, there's always a competition between siblings, especially if they're close in age. And you always want to handle it in an unbiased way. You always want to set some limits, some rules in the house. And if one sibling is acting aggressively towards the other, that is a behavior that should have consequences. And same on the other, for the other sibling. And again, using positive reinforcement. If they're doing something good, if they are playing well, you want to encourage them, you want to praise them. Oftentimes what parents do is that whenever there's a negative behavior, they react to it. But if things are going well, it usually goes unnoticed. So if they're playing nicely, you want to praise them. You want to offer a lot of positive reinforcement, and maybe you want to reward them for that, so that that positive behavior is going to be reinforced more and is going to increase further. Obviously, if it gets to a point where it gets to the point of pathological aggression where you're not able to control what's going on, it's always helpful to get a therapist and see if they can help you navigate that. Any other question? So let me just look at the time. So it's 12:11. I'm going to give a couple of more minutes to see if anybody has questions. Great. Well, thank you, Jazakallah, for listening to me. And I hope that this has been helpful. And if you guys have any further questions, you feel free to contact me. And I hope you guys have a wonderful day. Allah Hafiz.